Just moving forwards, I'd love to introduce you now to our three doctors. Please remember that there's this section of feedback from our doctors, there's a theological reflection, and then the bulk of our time will be set on answering questions. So by moving forward, is that you, Dr. Rebecca?
I'm here. Would you like me to introduce myself?
Oh, please do. Thank you very much. Thanks.
Thanks. So my name's Dr. Rebecca Payne. I'm a GP. I live on Anglesey and I actually work on Orkney. I'm one of the out-of-hours GPs there. So every 8 weeks I drive up to Orkney through Scotland in my little van to work a week of nights and then travel back to Anglesey. The rest of the time I work for the Care Quality Commission in England, so the Inspectorate and Regulator for Health and Social Care. And I've been very keen to be involved in the vaccination programme locally. And I'm on the medical bank in Ysbyty Gwynedd in case any shifts come up. But the response of people that want to vaccinate has been so overwhelming. They've had absolutely no need of me so far, which I'm gutted by because I'm really, really keen to get involved administering those vaccinations. Everything we've done till now in the COVID pandemic is dealing with the consequences. But this is something that is actually saving lives and making a real difference. So it's really exciting that it's being rolled out at such pace.
Thanks, Dr. Rebecca. That's really great. Can I introduce also Dr. Kofi Obiwobi, who is a consultant physician and endocrinologist at the Royal Gwent Hospital. Dr. Kofi serves on the First Minister's Special Advisory BAME COVID Risk Assessment Group and is part of City Church Cardiff. Welcome to you, Dr. Kofi.
Thank you very much, Shan.
Welcome. So how are things from your perspective on the ground? I mean, you must have had a phenomenally busy year. Tell us how things are panning out on the ground for you.
I think it's obviously, if I had to sum it up in words, this time last year, very much the words were challenging, difficult times, despair for our communities, despair for our patients, despair for and really difficult times for our health services. Our hospitals were really on the rack, and more so for our patients as well. People were going through, very, very painful times, loss of family members, loss of dear ones. People were struggling with illness, not being able to look after the problems that they already had in the first place. And then also problems because socially, increasingly because of lockdown, people were isolated as well. And so not being able to get on with life as it is. Now, over time, it got better for us. We also saw that a bit in the summer, and there was a little bit of hope, and then the second lockdown. But now, actually, we've moved to a place where now we begin to see, as spring comes, the small shoots of hope and, the light at the end of the tunnel, so to speak. And obviously, the vaccine program has made a huge difference. I see now, especially today, I'm talking about patients I've seen in clinic, there is hope. People feeling that, look, we are going to definitely come out of this. So it's a very good thing to embrace. And I'm delighted that we're in this position. Not out of the woods yet, but at least we are heading there.
Okay, thank you, Kofi. We'll return to you in just a few minutes as well. And then our third panelist is Dr. Owain Edwards, a local GP and vaccinator up in Bala, North Wales. Croeso, Dr. Owain, chi'n iawn?
Fi'n champion, diolch yn fawr am y swaith I chi gyd.
Now, you've been busy vaccinating. Just tell us a little bit about that story and how it's going for you as a local GP up in Bala.
Yeah, I think, as a GP on the ground and, so many other people in different professions have seen the first-hand effects, haven't we, of the direct effects of COVID, with the losses in family, and the illness that it's brought, but also just the social isolation, the effect on mental health, has been huge. The effect, we see, in our children and young people, especially, And it's been, in many regards, it's been a kind of a long year from that point of view, and trying to best support the community as best as we could in that. So to have the vaccine to come and be able to offer some kind of good news and a glimmer of hope has been a real privilege, really, here. And just generally the people in Bala, they're a lovely lot, and they're generally fairly appreciative of whatever help you can offer. But just to see the level of appreciation verging on the level of excitement from some people when they're actually receiving their first vaccine, and seeing that there's a hope here. As Dr. Kofi says, we are by no means out of the woods at all. There is still a long way to go. But I think we would all say that initially, when this was all starting back in a year ago, we're thinking, okay, this may last maybe for a few months, and then but when that second wave started to come, and we realized, without any other intervention, this is a serious disease that's going to trouble us as a society for a long time. So to be able to come and bring the vaccination, we do some in the surgery, and then we hire out the leisure centre, and just to see the people troopsing through, and just even leaving with a smile, just knowing that for them personally, especially the ones who've been shielding and the ones who've been very isolated, they even though they still have to do that for the time being, they're seeing that there's a hope at the end of the tunnel with it. So it's been a privilege to be a part of that.
Brilliant. Diolch o galon, Dr. Owain. Again, we'll come back to you and the other two doctors in just a little while, but thank you. Thanks so much.